So I'm Lloyd Michener, family doc. Actually grew up as a community health organizer, in the civil rights movement. That says something about my age. No comments are needed. But have been working in Durham, North Carolina for about 30 years about how to improve health outcomes. North Carolina is interesting, like many of the other states here. But Duke actually provides care for about 96% of the county. That's a very unusual model, and it meant that actually we could look at health outcomes and health issues in a really unified way, including starting one of the early medical home demonstration projects disseminated statewide, and then more recently a much more integrated model about what would actually take to form partnerships that could improve health outcomes, first across Durham and then across our region and then across the state, including and then much more broadly. The most recent work, which folks here know, was the IOM work, and then the work with the De Beaumont Foundation support, and then CDC and HRSA about the practical playbook. How do we find examples that are your stories, and how do we actually extract what was key about that and share it? And what is it that makes that useful to you, powerful to you, and what is it that sometimes makes it not work? And so we've done a lot of usability testing back and forth, trying to make sure that the messages that came from Ted Winslow's story of Ohio actually made sense in Vermont. Well, that may be a bad example, but what is it that makes those stories telling, and how do we actually carry that forward so it's of use to you? And how do we form networks of all of you so that we drive this transformation? Maybe you heard, I will shut up. We just are launching a major expansion of that, announced that last night. So we'll be back in touch with everybody, just about everybody in the room, about your stories and what the key lessons were that you want told so others can learn what you're doing.
Cool. Thanks. In contrast to Lloyd, prior to a few weeks ago, I knew absolutely nobody in this room except Sandy Magnan, and I had talked to George Isham, I think, twice on the phone over the past 10 years. So everyone else is a new acquaintance. Happy to meet you. I am Executive Director of Wilder Research, as you heard. That's an organization in St. Paul, Minnesota, about 90 people on the staff. We do studies of the effectiveness of programs in fields of social services, public health, community development, housing, a number of areas. We also do studies of community trends. Collaboration I came to in probably three ways that are relevant for today's discussion. One is 20 to 25 years ago, we took a look at the literature on collaboration to try to see if we could develop any evidence base out of it to extract factors that influence the success of collaboration. Difficult job, because then, as now, most of the research on collaboration is case studies. It's not amenable to the kind of meta-analytic work you'd like to be able to do in synthesizing information. But we did publish a book called Collaboration, What Makes It Work. We did a second edition of that book in 2001, and actually we're updating the literature right now to probably put out a third version of that book, along with a companion inventory assessment tool, which is free online. It's listed in the resources that you have in the resource guide. So feel free to go and use it as much as you want. Anonymous NSA may know that you've used it, but we won't know that you have used it. Second thing of relevance, I think, to mention here in terms of my background in collaboration is I've participated quite a bit in the Robert Wood Johnson AF4Q network during the past 2 or 3 years. I've actually spoken with representatives from all 16 of the sites that were in the meetings where I participated. Given my age, I don't know that I can tell you anything that they told me. I'd have to go back to my notes, but at least I've touched base with all of them and learned a lot from that experience. The third thing I would mention about what I bring to this is during the past few years, quite intense participation in about 4 or 5 projects that fall under the rubric of fostering collaboration between health and public health on the one side and community development finance on the other side. And one observation I'd make, even based on just this morning, is that as an outsider, kind of try to learn more about what you're doing, it seems to me that public health, primary care, health care are kind of living in the same building. They may be on different floors of that building. They may not walk to the different floors, and they may develop stereotypes and suspicions about the other floors. They may not talk all about the same, they may not all talk the same language, but they are more or less in the same building. Bringing in community development finance is really bringing people from a totally different building together with healthcare, public health, to try to achieve ends. And I see a number of you nodding because you're very familiar with this, but there are many public health professionals who would think, what? People who make small business loans, I need to collaborate with them to improve public health? But think about it for a minute. Small business loans create businesses. Businesses create jobs. In job creation, a number of things happen. Retail centers and places for those jobs to be sometimes improve the environment by cleaning up fields or whatever. Jobs are created, which creates income. Housing stabilizes for people. So suddenly, in one fell swoop, the people who are doing loans to small businesses, who you might never think of as public health practitioners, are addressing key social determinants of health related to poverty reduction, related to stability of housing, related to improving the environment. And so the Robert Wood Johnson Foundation and the Federal Reserve Bank, in their wisdom, have come together in sort of promoting a national movement to bring those disciplines closer together. And there are a lot of challenges in vocabulary, technologies, and other things similar to, but much more intense than the things we were discussing so far today. So that's something on the background of both of us. And I guess as an opening question, Lloyd, this shouldn't be too difficult. If you were asked, you're on the elevator, somebody says, hey, I hear this is a good idea, but why is it really a good idea? What's the most successful example of collaboration between healthcare and public health that you've seen, and why do you think it's so successful? Why should we bother to replicate that kind of thing?
Okay, I didn't know that was going to come. So I'll share, I'll have two quick examples. One I know well, one I don't. The one I know well, I'll do first, because I know it well, is that in North Carolina, actually the collaboration between the Medicaid agencies, the primary care practices, and public health has led to a 65% reduction in admissions for kids with asthma to the state over the last 5 years.
Is that a statewide initiative?
That's a statewide reduction from scale up of programs we did locally. The one I've heard that's even better, though, that I've not seen in, some of you may know this, is actually the city of Boston taking a very similar approach, is at 80% reduction. So the point is, when you start doing the linkages between primary care and public health and put them together, you magnify the effects the two can do separately and achieve something that actually really makes a difference in the lives of people.
Do you think those are capable of being replicated in other places? This morning we heard a lot about the importance of leadership, and sometimes, initiatives are built around the charismatic leader, but when you try to take them to scale elsewhere, it doesn't always work. So could other states or cities do those?
I think what we've heard in this room, what we've seen in Million Hearts, is examples of folks doing that in their own communities, in their own states, and now here, doing it across that. That in fact, this goes back to the original IOM report, where we said there are all these examples and nobody knew about them. They were short-lived. A few sustained, and we wrote them in the book. We had 4 examples. Now what we're seeing is this is occurring over and over again, and there's a common element of why that's happening. But not only can it is happening, and you're a witness to that.
What about the other side? What about failures? You're willing to point to something that just flat out failed? We didn't really hear about that this morning.
I think we all have those examples, and I'm going to go back to the discussion about language. To me, if you're not having things fail, you're not trying hard enough. In fact, I think it's the fear of failure that sometimes gets in the way. On the other hand, part of what we do training our learners is say, guys, actually, it's really hard to do worse than we're doing now. So have a little permission to try things and have them not go well and learn from them. Actually, we heard it this morning. First start. Know where you want to go, get alignment on that, and then get going and learn from it. I don't know that I call it failure, because though it is, it's really an example of, okay, you made progress in some areas and some others didn't. Now, what's the next step? So you see it as a journey. Or if you will, and I mean no offense by this, any of you have kids who play games? Maybe you play games. How often do you fail at a game? It's all about practicing and practicing until you get good at it. This is the same. you have to fail. You have to fall off the bicycle to learn to work together. You actually have to work together, have things that you agree on, things you disagree, get mad at each other. That's part of learning to work together. It's part of building programs together. It's part of what we all do every day.
So this morning, Dr. Applegate had a diagram up there that talked about the high level, the middle level, the low level, used, I think, some Greek words like meta and meso and whatever, micro. How have you seen those things practically play out in the collaborations you've been involved in?
Great question, and why I think this collaborative, this meeting is so important. Most of the early work that we've all done has been what we call the micro level. It's been inside a system, a practice. Maybe you could call it a community, though most folks wouldn't do that. But then you've linked at the local level, the meso level. You put together programs, maybe within counties, certainly within states. Now what we're doing is linking at the macro level. We're looking at how do we get organizations and structures aligned so we support each other's interests. That's major progress. Some of the skills required at the macro, the meso, and the macro level are the same. So one of the points I would make at this point is, actually, I'm going to turn it into a question. How many of you have had a partner that you didn't know about, a potential partner, come and approach you in the last month saying, hey, I heard about what you're doing, and either A, I'd like to help, or I'd like to play, or how come you didn't ask me earlier? As we start this movement up, as there's more people piling in, what we're learning is we actually have to go out and ask questions and find out who should be there, who isn't, and invite in those who may not have asked, and welcome in those who come to us saying, well, why didn't you ask us in the first place? Because we're at that point of connecting the networks, the macro networks, we're actually bringing others in as an inherent task.
As you're saying that, I'm thinking of what the research has shown as we've looked at factors influencing collaboration, and certainly having an appropriate cross-section of members is an important factor. But this issue of levels has seemed to be pointed, or the research seems to point to it as important, both at the community and regional and state levels, as has been described, but also within organizations. So that if part of an organization is involved in the collaboration, but not the entire organization, problems can result. If the practitioners start to move ahead too quickly with their colleagues in other organizations, and the managers or the CEO don't know about it, problems can come up. Likewise, CEOs who are out making promises, unaware of practically, operationally, what it takes to do the work, also can create problems in attempting to collaborate. Have you encountered any of that?
Only on days that end in Y. But actually, let me take it another step and go back to one of your other themes. Part of it is the need to connect within your own organization and bring others along. But now my question. My experience has been that sometimes I find I have to change the language I use as I invite others in. That was most clear when we did the work on the playbook, because we found that primary care and public health groups use the same words to different meanings. We can have a little discussion about that. And if you want to really practice your language skills, how many of you tried talking to a hospital chief financial officer? Anybody able to rattle off the adjusted, wait, I got to shift gears. Variable contribution margin per net occupied Medicare bed. Boom. Okay. You have to learn the language so that you can talk to them in terms that they understand. And that's true within our organizations, it's true outside. And just like joining another tribe or another, we have a sociologist here, another group, you have to remember who is it you're going to meet and how do they use language in ways that are effective. And I was really struck in the morning sessions how you guys were using language in your reports that you understood what they meant as opposed to talking past each other. I mean, that's just marvelous, and I think one of the things that happens as you do this.
Yeah. Let me take, the language issue is important, I think, both for language in and of itself, as well as the fact that it reflects disciplinary differences and cultural differences that have grown up and evolved over long periods of time. And maybe use this as the opportunity to throw it to the audience as you're sitting there. Any of you have an example of where language has been a barrier or a facilitator to collaboration, an example of where you've had to construct a vocabulary as a first step to promoting collaboration, a collaborative initiative?